Hey, good morning, you guys. Time for your health check. I'm basically going to spend some time answering as many of your questions as possible during health check for the next several weeks about COVID-19. So let's get to it. This one's from Ann Newton. Sonia, help me understand why a biopsy on thyroid would be considered elective, likely because that got postponed, right? Well, Dr. Mark Casanova helped me with this answer. Basically, the answer is threefold, okay? Procedures that aren't urgent reduce your exposure to hospital staff and other people in waiting rooms. It cuts down on staff and equipment that have to wear masks and suits and stuff like that, as well as the workload on labs, okay? Those healthcare workers also might be called out to help on the front lines. Dr. Casanova's advice for now: be patient, stay in contact with your physician, and if it becomes an emergency situation, your doctor will help you to navigate what needs to be done. All right, this one from Missy Buchanan. What are your thoughts about neighborhood kids playing in a group without parental supervision? Over the weekend, it seemed that there were kids trying to social distance, but they're kids having fun from at least 5 different families. Concerns me, but I don't want to overreact. Great question, Missy. Dr. Christopher Crow helped with this one. He says families getting together or going to friends' houses for play dates is not what we need right now. It's really hard for kids to stay physically distanced on their own, and remember, they can be carriers. So even if those kiddos don't get sick, they can come home and spread it very easily to others. So best right now to just hang out with the people who live in your own house. From Kelvin Porter, here we go. Everyone is telling us how to prevent, but how do you treat it if you get it and have to self-quarantine? This is also a good question. Dr. John Carlo addressed this during our town hall last night. Essentially, there's no solid treatment if you test positive for COVID-19. If you're one of those who is not hospitalized, you're basically at home in isolation for 14 days, and you would do almost what you'd normally do if you had a really, really bad cold, okay? If you have a choice between Tylenol and ibuprofen as a fever reducer, choose that acetaminophen. Stay away from healthy people, even in your own house or apartment, and use masks or other PPE if you're using a shared space like a bathroom in your house. And of course, thorough and frequent hand washing, still critical here, especially if you're sick. One quick shout out to someone in our Fitter Together group. Stephanie posted a free week for an outdoor fitness boot camp through Camp Gladiator. Now, it's usually outdoors, but now it is on Zoom and Facebook Live. So if you're not already, join that Fitter Together Facebook page. Got a lot of great freebies on there for you guys.